Yeah, we know from recent days that more and more police officers are simply feeling burned out, and they tell their employers, city officials, we need help. There's the stress, the long hours, the graphic things they see that they really don't want to tell other people about. If you're not in the law enforcement profession, well, now there's help.
We are talking about police, firefighters, dispatchers, correction officers, and EMS. It's a different population. They have their own different experiences.
Which is why Dr. Arash Javanbakht works on the Frontline Stronger Together program developed by Wayne State's Psychiatry and Behavioral Health Sciences Department. It gives first responders the mental and emotional support they need for their very tough jobs.
It's their program. It's run by them. We work with the police union. We work with the fire union. We have them on our steering committee.
The program is fairly new and just in time.
For a number of years, the officers of the Melvindale Police Department have sounded the alarm that our police department is heading toward the edge of a cliff.
Last week, Melvindale police officers were among many giving city officials across the region an earful about the increasing pressures they face on the street.
We are burned out. Morale has been dead for years. We are physically, mentally, and emotionally exhausted.
The trauma and stress in this population is different than most other people in a way that I may have a horrible car accident, or I may be, let's say, assaulted. Then I come back to my usual, safe, normal life and I can recover. But for these people, it's every single day.
Officers and other first responders can call the program and be cared for by their peers who know exactly what they've been through.
We have different ways of helping. Part is therapy or psychotherapy, or what we call talking cure. There are different ways of it, talking about the trauma, talking about the meanings and perceptions the person has created after the trauma. For example, I'm a bad person because this happened to me. Feelings of shame, feelings of guilt.
Treatments also include augmented reality devices like this one to help first responders approach social situations in a healthy way while being treated for job-related PTSD.
Like Iron Man, you wear the goggles and you're in a room, and then gradually people come and you're interacting with these virtual humans. And of course, you can imagine in the long run this can be used also for training.
A big part of the key here is breaking the stigma of talking about mental health.
A lot of times, the person, they themselves don't know what's happening. I've had police officers that have been dealing with PTSD, not being able to sleep or have nightmares every night for years before a peer told them that, hey, this is a problem that can be solved, go seek treatment.
And we can certainly tell you that the state of Michigan sponsors this program, and more police departments across the country are looking at programs like this. Reporting live in Detroit, Dave Kinchin, Fox 2 News.
And so many first responders actually develop this. A great percentage, we're reading like 30%, develop mental health issues because of what they see on the streets and what they're dealing with. And that's why it is so important that they do get help right away, and it's available.
Yeah, it really is, and especially when so many folks in law enforcement, they just feel like they can't talk to folks who are outside of that profession because they feel like people won't understand. In this case, peer-to-peer is so critical.